Good day, everyone. My name is Okati Yonchana, and I'll be presenting my capstone project title Reducing HIV/AIDS Stigma, Increasing HIV Testing Among Adolescents in Bamenda, Cameroon. This project is supervised by Mr. Kaushal Sharma. In this presentation, I will discuss the background of the study, the problems being addressed, the method used to collect and analyze information, the findings of the project, and recommendations. Thank you for taking your time to listen today to my presentation. Introduction. This capstone project focused on reducing HIV/AIDS stigma and increasing HIV testing among adolescents in Bamenda, Cameroon. HIV remains a major public health issue, especially among young people. Many adolescents are afraid to go for HIV testing because of the fear, discrimination, stigma, and lack of awareness. The purpose of this project is to examine the cost of HIV/AIDS stigma among adolescents and explore strategies that can encourage more young people to get tested. This topic is important because early HIV testing help with prevention, treatment, and reducing the spread of HIV in our communities. Statement of the problem. The main problem identified in this project is that HIV stigma continues to discourage many adolescents in Bamenda from seeking HIV services. Many young people fear being judged, discriminated against, or rejected by family members, friends, and society if they are associated with HIV testing or HIV/AIDS. Other factors such as limited awareness, misinformation, fear of positive results, and lack of youth-friendly health services also contribute to low HIV testing rates among adolescents. If this problem is not addressed, it may continue to increase health risks, delay treatment, and contribute to the spread of HIV among young people. Therefore, this study aims to explore the cost of stigma and identify practical solutions to increase HIV testing among adolescents. Literature review. Literature review. HIV stigma is a major barrier to testing. World Health Organization and United Nations AIDS emphasizes stigma reduction. Adolescent fear, shame, and discrimination. Youth-friendly healthcare improve testing rate. HIV education programs help to reduce stigma. Framework. The main objective of this project is to examine ways of reducing HIV stigma and increasing HIV testing among adolescents in Bamenda, Cameroon. The specific objectives include to identify the major causes of HIV/AIDS stigma among adolescents, to examine the effect of stigma on HIV testing behaviors, to evaluate strategies that can encourage HIV testing among adolescents, to provide recommendations for improving awareness, education, and access to testing services. These objectives guide the research process throughout the project. Data analysis. For this project, different methods were used to collect and analyze information. The research involved gathering information from reliable sources such as books, journal articles, health reports, and online academic resources related to HIV/AIDS, stigmas, and adolescent health. The collected information was carefully analyzed to identify patterns, challenges, and possible solutions related to HIV testing among adolescents in Bamenda. The methodology helped ensure that the findings and recommendations of this project were based on credible and relevant information. The findings of this project show that HIV stigma continues to affect many adolescents in Bamenda. The research revealed several key challenges, including fear of discrimination, lack of accurate information about HIV/AIDS, peer pressure, cultural beliefs, and concerns about confidentiality and families. The analysis further revealed that education, community awareness, campaigns, youth-friendly health services, and counseling can help reduce stigma and ensure HIV testing among adolescents. The findings support the importance of collaboration between healthcare providers, schools, families, community organizations, and policymakers. Summary of findings. Based on the findings of this project, several recommendations were made. First, there is a need for increased HIV/AIDS education and awareness program targeting adolescents and community. Second, schools and community organizations should provide accurate information about HIV prevention, testing, treatment, the use of post-exposure prophylaxis, and even the use of pre-exposure prophylaxis to help reduce stigma and misconception. Third, healthcare facilities should create more youth-friendly confidentiality HIV testing services, encourage adolescents to seek testing without fear. Fourth, policymakers and public health organizations should support the programs that promote HIV awareness and adolescent health education. Finally, communities should work together to create a supportive environment that reduces discrimination against people living with HIV. Recommendations and conclusion. In conclusion, this capstone project examined the issues of HIV/AIDS, stigma, and low HIV testing among adolescents in Bamenda, Cameroon. The research showed that stigma, fear, misinformation, and lack of support to continue to prevent many adolescents from seeking HIV testing. The findings also demonstrated that education, awareness, youth-friendly health services, and community support can play important role in reducing stigma and increasing HIV testing. This project contributes to the greater awareness and provides recommendations that can help improve adolescent health outcomes in our community. The project has helped me strengthen my research, my communication, and analytic skills. Thank you for listening to my presentation. I would like to sincerely thank my supervisor, Mr. Kaushal Sharma, for the guidance, support, and valuable feedback provided through this project. I also appreciate my classmates, family, and everyone who supported me and encouraged me during this project. Finally, I acknowledge all authors, research, and sources referenced in this work.